Hi, I am Dr. Chakradhar, consultant neurologist at Renova Hospital, Sanat Nagar. Now, I'll be discussing a common issue, that is a headache, which is a common symptom that we see in the OPD day in and out. One need to have a brief understanding about these headaches, so that when should one be worried, really worried about, and when one should get relaxed, depending upon the symptoms. So, most commonly, the migraine is the primary cause of the headaches in primary headaches. However, there are other conditions that can cause the headaches. Some simple conditions like even the stress or decreased sleep or any infection, sinusitis, or those kind of simple reasons also can cause the headaches. However, some see there are certain serious causes that has, such as bleeding in the brain or some kind of tumor or infection in the brain or significant trauma in the head can also result in the headaches. Discussing about the most common headaches, that is migraine. Usually, this kind of headaches result in unilateral headaches, that is one-sided headache, which will be throbbing in nature and pulsatile quality, as well as associated symptoms such as nausea, vomiting, and visual blurring can also happen. However, rarely some can feel the one-sided weakness or other symptoms. And before the in few, which is classic migraine, most classical migraine, few patients may develop the aura, that is seeing a colored halos or before the onset of the headache. Now, this pain which they pursue in the one side of the head commonly may be lasting about 4 to 72 hours, or a minimum more than 4 hours it lasts. And as I told, the associated symptoms may be there. Depending clinically, this is a clinical diagnosis based upon the symptoms and based upon the pattern of the headaches. We clinically, there are no definitive tests to diagnose the migraine. However, we require few tests in case of suspicious to rule out other causes. Now, coming to the migraine, initially in a very free unfrequent cases, we use only the SOS when needed medication, that is routinely analgesics. Only when the headache comes, they can take a pill so that it will be relaxing. But in case of recurrent symptoms, that is more than 2 to 3 times a week and disturbing their routines, then we need to start on prophylactic medications, which are varied against several types of medicines that will be selected depending upon the patient profiles. However, the prevention aspect also need to be understood, because this is associated with day-to-day activities also, because whether this can be triggered by several factors such as decreased sleep or improper timing of the food, or excessive mental and physical strain can trigger the migrainous headaches, and certain types of foods or smells can also trigger these headaches. So try to avoid these headaches by preventing the exposure to these risk factors, as well as maintain a healthy and habit lifestyle, so that one can get rid of these headaches, and also it helps also in the prevention of these headaches. Thank you.